Making the decision to undertake gene transfer therapy for your child is a personal journey. Some find it difficult, while others have a different experience. Gene transfer therapies can potentially improve or stabilise the condition or certain symptoms of the condition. However, it is important to remember that every child is unique and outcomes may be different for different children. Every child's situation is different, even if they have the same condition. Therefore, it is important that you take the time to discuss with your medical team what the goals of gene transfer therapy are for your own child and what you hope to achieve. To help you understand the process better, it may be helpful to hear about the experiences of other parents who have considered gene transfer therapies for their child. The experiences may help you understand the potential benefits and risks of this type of therapy.
We are here because our daughter was diagnosed with SMA type 1. Whilst the diagnosis was not what you wanted to hear, I was fortunate it was picked up so early, and we were eligible to join the SPRINT trial to basically replace the faulty gene, I guess, or the non-existent gene.
You'd just given birth 13 days ago, and you got this newborn, your firstborn, that you're still trying to figure out everything, and then you hear this devastating news that she might not make it to her first birthday or second birthday. There's no cure. And then there's this trial that we don't know, might work. And I remember having a conversation with you and just saying, what are we going to do here? Are we going to just spiral down, or we're just going to be strong for her and just do everything we can? And then we just made that decision.
With everything in life, there is a cost versus benefit analysis done, whether you know you're doing it or not. And the more information you have on the treatment, the better.
Sometimes you just got to say no and insist. It's okay to be insistent. You are their advocate. And so within 24 hours, we decided that we were going to go into the trial, and I think we were very lucky. It was the best decision we ever made. Now I hope to be of comfort to other people, other parents who are going through the new diagnosis with their children, to know, give them some hope,
Yeah.
It is useful to take the time to think about the different options for treatment. Specifically, consider what to expect from gene transfer therapy, or whether you want to watch and wait and see whether there are other treatments available. As with any therapy, including ones that are commonly prescribed or sold over the counter, side effects are possible, though many of them are rare, and most are manageable with close monitoring with your medical team. Some more common side effects that can occur with gene transfer therapy can affect the liver, which can be picked up in blood tests, as well as vomiting and fever. Also, an infection such as a cold, flu, or bronchiolitis before or after gene therapy may lead to more complications. It is important to talk to your doctor and your medical team about possible side effects and complications. First, the medical team check that it's safe to give the therapy, and if administering it is likely to be effective. If gene transfer therapy is given, your child will need to be closely monitored with examinations and blood tests for many weeks, months, and sometimes years afterwards. Most of the side effects are easily managed, but some, particularly involving the liver and kidney, can be severe. Your child may need to take additional medications, such as steroids, on top of the gene transfer therapy. This is to reduce potential immune response to the envelope or vector carrying the genetic message, so that the therapy can be as effective as possible. Once the genetic material is inside the cell, it can't be taken out, and the potential long-term effects are unknown. If you are thinking about gene transfer therapy, you might like to use a checklist to help you explore the risks and the benefits for your child and help guide your conversations with your medical team. It's important to ask about the therapy, the procedure, and the ongoing medical care, as well as other considerations such as cost and the need to travel to hospital. Remember, always ask your medical team to explain the risks and benefits.
Talk to the people who have real-world experience, real-world knowledge, and that is your clinicians, your patient organisation groups. They're the most knowledgeable and the most important people you'll get the right information from. Tell them that you don't understand. That is their job. That is my job. I'm here to help you.
When you're in this rare disease space and you're faced with a decision of possibly an experimental treatment, you need to really weigh up a risk-benefit analysis, but you need to look at, well, what's my child's life like now and what could it potentially be like if we do this new treatment? If you consult with your medical team as well and you go through the options and the risks and the benefits of the treatment with them, then you can make a more informed decision.
When you have such a young child and you're trying to come up with long-term life decisions on their behalf, you're their best advocate. You're their voice. You're going to have questions. You're going to want to be searching for answers. You're going to want to challenge the information that you get. It will make you feel better knowing that your questions are answered and you're getting the information that you're after, because you're going into something that's so unknown.
Being able to fall back onto the medical staff, and you know, they were so good.
They became so close to us, like family.
Your doctors are always here to support and guide you. This video series is designed to inform you upfront, as ultimately this is a decision that you must make for your child or with your child. As you go through your journey, always remember to ask for support early on. Make the time to take care of yourself. Ask yourself what tools you need to make an informed decision. Keep talking and stay in contact with your medical team. And it's good to ask questions and clarifications with all the information you get. Focus on what works best for you so you can concentrate on what's most important and what things you want to know more about. More information on gene transfer therapy can be found on our website.